Have you ever had a day where your mind feels cloudy, your patience is thin, your sleep is off, and then your stomach starts acting up too? If you're a woman in your midlife years, especially between ages 45 and 55, and you're in the perimenopause or menopause phase of your life, this pattern is more common than most people realize. Today, I'm going to explain why brain fog and anxiety can sometimes have a gut component and what that means in a real practical way. I am Dr. Stasha-Gae Roberts, nurse practitioner and founder of Compassion Primary Care. I'm known for identifying patterns in my patients that can be contributing to ill health because far too many women are told their labs are normal while they still feel awful. I take that seriously and we look deeper. So let's define what we mean by gut brain. The gut brain axis is the two-way communication between your digestive tract and your nervous system. Two-way is key. Your brain communicates with your gut, and your gut communicates and affects your brain. This communication happens through our nerves, immune signaling, hormones, and microbial byproducts. So, no, this is not all in your head. This is how the body is designed. Now, why does this feel louder in perimenopause and menopause? Because midlife is a season of change, hormone shift. Sleep can become lighter or sometimes even non existent. Stress tolerance changes. Your nervous system can feel more reactive. And your gut motility, how food moves through your digestive tract, can also change too. So sometimes that used to be so something that used to be manageable can suddenly feel overwhelming. That doesn't mean you're failing. It means your physiology is shifting. You may need to talk to a trusted friend, a pastor, or do some biblical counseling, but we need to investigate further. Here are some ways gut imbalance can show up outside the gut. You can have brain fog, anxiety, irritability. You can feel wired but tired. Your sleep can be disrupted, and you're overly sensitive to stress. Sometimes women describe it as, I just don't feel like myself. And they're often told it's just stress, it's just aging, it's just hormones, and all of those can play a factor. But when we only use those labels, we miss the opportunity to look for drivers, especially when gut symptoms are also present. So if this is you, you may also notice gut symptoms such as bloating, constipation, loose stools or diarrhea, acid reflux, nausea, and abdominal discomfort. Here's a question I like to ask my patient. When the gut flares, does your mood or sleep change within the same day or two? If the answer is yes, then that's a clue that we need to explore the gut brain connection more carefully. So, in my practice, I see women from all walks of life. I see those who have tried everything. They're eating cleaner, they're exercising, they're cutting back on sugar, watching their carbohydrate intake, they're taking their supplements, they even may be in therapy. But I also see women who do none of those things. They're not exercising, drinking water, they're consuming the standard American diet. So we need to first start with an honest conversation. However, for those women who have implemented these lifestyle changes, but they still feel anxious, they still have brain fog, they still feel inflamed, and then they tell me their labs are normal, this is where root cause clarity matters. Because normal labs don't always capture function, patterns, or what the body is struggling to adapt to. So I ask better questions. When did this start? What makes it worse? What happens with bowel movements during the week? What changed around the time these symptoms began? How is your sleep? How is your stress? Are there medications that you have been taking for years? Have you had antibiotics recently? This is the difference between symptom chasing and pattern seeking. Pattern seeking looks at gut function and motility, sleep and nervous system regulation, inflammation signals, diet patterns, and fiber tolerance. Can you tolerate fiber? medication history, including acid blockers, history of infections or repeated antibiotics, and midlife hormonal changes that influence the whole system. And we do it in a way that's personalized and not some generic checklist. So, here are 2 practical steps you can take this week. First, track your symptoms for 7 days. Write down my mood, my sleep, my bowel habits, bloating, and stress. We're looking for patterns here. Second, ask yourself, am I constipated more than I would like to admit? Because constipation is one of the most overlooked drivers in brain fog and inflammation. We all eat every day, so we should be having a bowel movement at least once a day, ideally more often because most of us eat more than one meal a day. If this sounds like you and you're ready for a deeper personalized approach, please visit my gut health page, compassionprimarycare.com/gut health. You can find it here in the comments. You can learn more about my process and request a free discovery call. And I want to hear from you today. So, what's been harder lately? Brain fog, anxiety, sleep, constipation, or some other issues? Feel free to drop a comment in the comments section. And I'd like to thank you for taking the time to view this video. Again, I am Dr. Stasha-Gae Roberts, nurse practitioner and owner of Compassion Primary Care. Please like, follow, and share. And I would love to help you and assist you in nursing your journey to lasting wellness. Thank you. Bye-bye.